Item hash SCP-3349. Object Class Keter. Special Containment Procedures. Individuals affected by SCP-3349 are to be admitted indefinitely as inpatients under routine care in Foundation long-term acute care facilities so as to not re-expose SCP-3349 to civilian physicians and the medical community at large. Reports of instances are to be intercepted by field agents, who are to use experiential discretion regarding the use of Class C amnestics. The cardiac activity of patients admitted with SCP-3349 is to be monitored at all times by a centralized telemetry unit, continuously staffed with 2 12-hour shift clerical personnel. Instances of SCP-3349 are to be reported by the clerical staff to the nursing staff promptly via an exclusive telephone line. Electrical manifestations of SCP-3349 are to be captured when possible. The printouts catalog both in the patient's analog and electronic record. Beginning in 1941, SCP-3349 has been actively expunged from the civilian medical community and literature, initially per endeavors of Mobile Task Force Gamma-5 Red Herrings, and since continued by the ongoing global acquisition and obfuscation of case studies by the DEA. Description: SCP-3349 is a non-fatal cardiac arrhythmia that has a 42.8% incidence following a specific sequence of intravenous drug administrations. 150 mg IV drip of amiodarone infused over 15 minutes, 1 GIV infusion of magnesium infused over 1 hour, 1 ampoule of sodium bicarbonate infused over 3 to 4 minutes, 0.1 mcg IV of epinephrine immediate push. SCP-3349 is not constant and appears periodically in the affected individual with an average of 9 occurrences per day, lasting for an average of 3 minutes per occurrence. Subjectively, patients report feeling comforted, elated, and euphoric. Objectively, SCP-3349 produces a fluttering central and peripheral pulse upon palpation, often described as tactilely similar to a purr of Felis catus, a common house cat, and can be auscultated with a stethoscope. The clinical descriptions also citing the purr of Felis catus point to. On electrocardiogram, SCP-3349's manifestations display commonalities with the waveforms of human vocalizations. Spectrographically reconstructed audio signals 3 based on SCP-3349's electrical signatures produce various intonations of human-like laughter, wailing, and speech. See audio data below. Auditory outputs resembling the purr of Felis catus have also been reported. SCP-3349 is non-curable and is refractory to defibrillation at 200, 300, and 360 joules. There are no known precipitating or alleviating factors regarding SCP-3349 other than the aforementioned induction. Despite the erratic electrical activity, patients remain stable, though few may experience some reduction in exercise tolerance.